Hello, my name is Sydney, and today I'll be talking about two standards that I use in my role as a CSSD technician to ensure that my patients are receiving the best care that I can provide for them. The first standard that I'll be talking about is the Australian Standard of Reprocessing of RMDs and Other Medical Devices, or AS5369. This standard, even though it's an Australian standard, is very widely used throughout New Zealand as a best practice standard. This standard could be set up into two sections or two parts. Part A being the mandatory part and Part B being the informative or non-mandatory part. In Part A, we have the scope, which tells us that this standard is here to provide a detailed step-by-step process and requirements for the safe, effective, and repeatable reprocessing cycle of RMDs, and that it is applicable to any environment where there is an RMD that could be reprocessed, and therefore is applicable to anyone who is tasked with carrying out the reprocessing cycle. It also tells us that there are exclusions to this, being, single-use items that are only designed for one use and then to be chucked out, consumables such as bandages and gauze and dressings that can't safely be reprocessed for their next use, non-medical devices or things that are really not meant to be used in medical practices, and any kind of case that involves prions or, with emphasis on CJD or mad cow. There is also mention that due to the principles of infection control, RMDs are not to be used interchangeably between any live patient, including organ harvesting, and any kind of post-mortem event or autopsy or anatomy dissection, any kind of veterinary clinic or veterinary medical, and any kind of preclinical training involving human or animal tissue. Part B is the non-mandatory or informative part of this standard, and it includes information and further guidance or interpretations of this standard, as well as some references of standards predating this current one that we're using, to help further our knowledge as a reader and as, give educational background for the use of this standard. The next standard that I'd like to talk about is the NZ8134 standard, or the Health and Disability Service Act standard. This is a legally binding document for all facilities that are operating under the Health and Disability Service Act of 2001, and it applies to both private and public facilities. As long as they are operating under this act, this standard comes into play. It is also encouraged to be used by those who are not under the act because it is seen as best practice. Although it might not seem that these two standards have a lot in common, they do have direct and indirect links to correlate with one another. So the Health and Disability Service Act, or the NZ8134, is a legally binding document for all those who operate under the Health and Disability Service Act, right? So if your facility is one that falls underneath that act, then that means that you as a provider are legally required to follow your New Zealand Health and Disability Act. It also means that if you use another standard to make sure that your processes are correct, such as a Australian standard for processing, like we do, that means that you are legally bound to follow your Australian standard, right? So because, if that makes sense, because we're following best practice with our New Zealand Health and Disability Act standard through our facility, because we work for our facility, we're also now legally bound to follow our Australian 5369 as best practice for our reprocessing. So that is our indirect. Our direct link comes from our Section 5 in the NZ 8134 standard, which is the Infection Prevention and Antimicrobial Stewardship section. This section tells us that we need to be complying with our best practice standard, which is our AS 5369. There are 2 clauses in this section that will detail out how we need to be following our best practice. 5.2.3H tells us decontamination and reprocessing of reusable medical devices and equipment should be following best practice. And 5.2.9 says that service providers shall ensure that reusable medical devices and shared equipment is to be appropriately decontaminated and reprocessed based on recommendations from the manufacturer and best practice guidelines. And our best practice, there again, is our AS 5369. Some examples of the way that I know we are in compliance with our standard is the way that we document our process. We have a TDoc scanner, and that complies with the AS 5369 Section 2 Quality Assurance, Identification and Traceability of Reprocessed Items through the Process, 2.1.2E. We use the TDoc scanner. We have a program that logs anytime we scan ourselves or an item or the end of a process throughout its life cycle. So each tray, each single pouched item has this program following its history at all times. The next way is same standard AS 5369 2.3.3 2.3.3B and C, cleaning process records and sterilization process records. We sign our printouts. When we are going to TDoc scan our end of that part of the cycle, we check both of our printouts. With our washers, we're checking that the correct cycle has been chosen, that our chemistry is correct, that our disinfection time is long enough and hot enough, and that the cycle has indeed passed. The machine can tell us that it's passed, but if those requirements haven't been met to our validation, then it has not been passed. And same thing with our sterilization. We're checking our sterilization printouts, making sure that the correct cycle was chosen for what was put through, that there was the correct amount of pulses for steam, and that it reached the proper sterilization temperature for the proper amount of time before we release that process. And finally, my last example is through the NZ8134 standard, 5.5.1, which says that service providers shall ensure safe and appropriate storage and disposal of waste and infectious or hazardous substances. Our chemistry is set in a different room with labels the labels facing out so that we can tell what kind of chemical that is and if it needs special masks or gloves to be handled. And as far as infectious waste, when we have stuff at the decontamination site, it's dirty. It's got blood and bodily fluids all over it. We have sharp spins to deal with things like needles, and sometimes single-use items can be kind of sharp and we don't necessarily want them in our general rubbish container, so we'll put them in the sharp spin. And we also have a general rubbish, but it is a black bagged and is, when we tie it off, it is sent to a special place meant for disposal of like bodily fluids and such. And of course, we're all always wearing our PPE and also in compliance with our standards. So overall, those are the 2 standards that I use, and those are the examples of how I implement them in my workplace. And thank you for listening. Bye.